My brother Tony, he's the oldest. He's 10 years older than me. It happened because he was working on a car. The car was jacked up, the jack broke, and then the car landed on him. So he obviously had to go through a surgery. Essentially, it started as just some painkiller, and then it led to needing stronger painkillers, and then it progressively got worse. In 2018, when I started streaming, he had a heart aneurysm, so it wasn't even drug related, his passing. So it's kind of sad that he was able to finally break from it, but he struggled with it for so long. And then after losing him, I knew that there was more that I wanted to do to share, because my story is unique, but many families go through the same thing. I found them through streaming. It started because I was in a Twitch group where every month we would select a charity to support. I researched and chose Shatterproof, and then I was able to raise over $1,500 on my own.
My older son, Brian, was struggling with addiction. Tragically, on October 20th, 2011, I was woken up in the middle of the night and on my phone ringing. And when I picked it up, I was told that my son had just died. He was 25 years old and he hadn't used a substance in 13 months. In the months that followed, I really struggled with two questions. What could I have done differently as a father? And what could be done to spare other families of what we had, the tragedy that we had suffered? But there was one thing that stood out far and above everything else. That Brian didn't have to die. All this research existed that had been funded by the federal government. And it was great research. Research that had proven through randomly controlled trials to be able to prevent many of our loved ones from ever using drugs and becoming addicted. Research that had proven through randomly controlled trials to significantly improve outcomes for those in treatment, on par with other chronic illnesses like heart disease, diabetes, and research that existed how to reduce a killer as equally as large as prevention and treatment, which is shame and stigma. A vision emerged of bringing together millions of Americans and empowering them to ensure that this research was implemented throughout our society, just like it's done for heart, cancer, diabetes, and all the other major diseases in this country. Transforming the treatment system in the United States for the treatment of addiction, changing the knowledge, attitudes, and behaviors of this country related to this disease to end the stigma for those afflicted with it and the medications that treat it, providing the information to families in highly accurate or scientifically accurate and highly curated formats consumable by families on the prevention, treatment, recovery of this disease without any shame or stigma.
Feel hopeless yourself, that they aren't either capable of changing, or it feeds into the stigma. It's not viewed as, this is somebody that needs help and you need to point them in the right direction. It's, they're choosing to do this.
My son did not die of an overdose. He took his own life. And why? Why did a 25-year-old, otherwise healthy person, young man, otherwise healthy young man who hadn't used a substance in 13 months take his own life? I've never had to wonder. He wrote about it in his suicide note. He said, it's not being treated like a human after I've worked so hard to get back to normal. My son didn't see a world where, as a young man, he could develop a disease, get treated in our healthcare system, get better, and live a full and fulfilling life without any judgment or shame or stigma. Well, we can change that.
My family was super close, and I feel like if we couldn't openly talk about it or help, it's like, how are other people that don't have that blessing, going to be able to do it? So that's why I think it is so important to break down that stigma and just bring awareness to it, because he had faults, but he was absolutely a great person.